Welcome to all of the listeners to our weekly podcast about localization and sustainable development in times of COVID-19. Today, we have the great honor to welcome Mr. Adrian Vanderknap, Managing Director of the Farm to Market Alliance. I'm looking forward to discussing with him how true localization efforts can help us tackle the current challenges imposed on us by COVID-19, as well as paving the way for sustainable development in the long run. Adrian, you're very welcome.
Thanks for inviting me, Grace. Great podcast, by the way.
Thanks so much. Before we start talking about the Farm to Market Alliance, will you help us out by explaining what localization is all about?
Sure. There's no single definition of localization, but we can refer back to the Grand Bargain, a 2016 agreement between some of the largest humanitarian donors and agencies. In it, under the heading of more support and finding tools for local and national responders, signatories agreed to making principled humanitarian action as local as possible and as international as necessary.
I like that. As local as possible and as international as necessary.
That does not mean that international actors are less important. The commitment in the Grand Bargain is in parallel with recognizing their vital role, in particular in situations of armed conflict.
So, is that now the accepted definition of localization?
Well, other actors have their own interpretation and localization goals. For example, in the Pacific, local governments, national societies, and local and national NGOs define localization as a process of recognizing, respecting, and strengthening the independence of leadership and decision-making by national actors in humanitarian action, in order to better address the need of affected populations.
So is it very focused on local action, or could a balance be struck between local and international action?
A great question. It's based on the principle of complementarity, striking a balance between local and international, because that will maximize the competitive advantages of both.
So let's talk about this in practical terms. If a disaster hits, where can we see the advantages of localization?
One of the strongest areas where this is obvious is linking preparedness and response. If preparedness work has been done correctly and the capacity of local actors has been strengthened sufficiently before the disaster happens, they can typically react much faster because they are close to the affected population. Also, local actors often have access that no international actor can achieve.
I'm also guessing the local actors would naturally have a strong understanding of local circumstances, politics, and culture. That must be a huge advantage, in particular in complex emergencies.
Absolutely. But since you bring up that question about disaster relief, I'd like to clearly make the point here that the differentiation between humanitarian aid and development is very much overstated.
So when people are talking about localization, are you saying there's really no need to separate them?
Exactly. A humanitarian relief program should always, from day one, establish a connection and say, we're coming here to assist people after the disaster, whether that's due to floods or an earthquake. But how will our involvement end? What is our exit strategy? And what is our long-term strategy? With all the money we're bringing in, especially after a large-scale emergency, how can our work feed into long-term development programs and sustainable capacity building?
Sounds like a good cohesive strategy.
Yes, but unfortunately we don't do that enough. On the development side, we do not look at the humanitarian angle enough. For example, preparedness and resilience. How we can work better together. There should be no emergency without development, and there should be no development without considering the impact of a future emergency. When an emergency does happen, we cannot pack up and say, there's an emergency now, so let's stop our development work and come back to it in 2 years' time. We have to bring emergency and development together and maintain a continuum so initiatives are not falling apart.
It sounds like having a connected strategy would really shape the effectiveness of your work. Let's talk now about the Farm to Market Alliance, which is known as FtMA. Just to give the listeners to this podcast some background, this is a joint venture of public and private sector organizations. On the private side is Rabobank, Bayer, Syngenta, and Yara, a big fertilizer company in Norway. On the public side is the World Food Programme and the Alliance for a Green Revolution in Africa, AGRA for short. Tell me, Adrian, where does the FtMA come into play? Let me guess, in a humanitarian as well as a development context?
A good guess, Grace. The member organizations you mentioned aim to establish sustainable food systems by strengthening local food markets and value chains, to empower farmers to increase their yields, incomes, and resilience, and ultimately to improve food security at large scale.
Sounds like investment in infrastructure is important there. What about policies? Do they play a part too?
Both are needed to support FtMA's effort to create an inclusive commercial environment through those food value chains. Our mission is to make markets work better for smallholder farmers, so they have marketable surplus or potential for surplus. FtMA is working through partnerships with big buyers like food processors, millers, breweries, through agri-related businesses in the credit sphere and in the inputs.
Will you explain for our listeners what you mean by inputs? Seeds, fertilizer, that kind of thing?
Yes, that's right, plus logistics and mechanization services. At the heart of our alliance is the Farmer Service Center that provides advice to farmers where needed. It helps with making deals with traders and aggregators or buying the right inputs. The Service Center is there to support the farmers, but they are paid via a commercial system through the commission they make. Our first objective is to sustainably improve the incomes and resilience of smallholder farmers. The second is to develop economic viability for all stakeholders in the food value chain, and that can be our members, but also other related agribusinesses.
To me, that sounds like an initiative that's driven by the localization and sustainable development concept everyone has been talking about since the World Humanitarian Summit in 2016.
Oh, you were there too? We must have missed each other. Sorry about that.
No problem. We'll meet for coffee at the next event. A lot of conversations took place there and have continued since then about localization and sustainable development. But to be honest, we don't hear very much about the kind of projects you mentioned. Are they so local that they're hard to find, or is there just not much happening in this field?
I don't claim to be all-knowing about what happened with localization since that summit in Istanbul, but in most of what I've heard or read, the discussions seem to be mostly around funding. Should the funding be provided to or through an international organization? Or should the funding go directly to a local organization? In my opinion, localization is not about funding. It should be much more about actions that change the way we provide development and humanitarian assistance.
Could you give us an example of how that makes a difference?
Sure. In a big crisis where we do food distribution, such as in South Sudan or in Kakuma, imagine thousands of people sitting in the rain or in the sunshine, all in lines, and NGOs will be scooping the food. Then the people have to walk back to where they live with food they got for their whole family for a month or even longer. That's the system that's been in place since the Second World War, and unfortunately, it hasn't changed since. Is the food distribution process hygienic, especially now in a pandemic? Does it take into consideration the safety and security of the women who have to walk back to their homes and camps, often for 5 kilometers and more? Will the food be stored properly at the households for a whole month? How are local businesses benefiting from that way of providing assistance? For me, this has nothing to do with localization.
A lot of questions there to think about. Could the dilemma be summed up as what systemic changes would provide better and more sustainable solutions to the needs of the local population?
Absolutely. Let's use Kenya as another example. The World Food Programme already started years ago with a program to build the capacity of the national government to hand over relief for all sorts of disasters. By handing over, you automatically have a localization effect because it's now the responsibility of the government of Kenya or their counties. We should be much more active in saying to governments, you have to take on your responsibility. If you really can't, of course you can come to us and say, can you assist us with these problems? But the first line of responsibility is with local and national governments. And I don't think we put enough emphasis on that. I see Kenya as a good example of doing it well. Ethiopia often talks about it, but I still see major roles being played by international organizations where there's only a relatively localized need for humanitarian assistance. So, if we push for more delegation of responsibility to county governments or the national governments, then that is localization.
Let's talk about the huge challenges COVID-19 is posing for the humanitarian sector as a whole. Many people would argue that the pandemic is uncovering a lot of issues and weaknesses in humanitarian and development systems. To what extent can projects like the FtMA offer solutions?
COVID-19 has caused significant disruption to many global international supply chains. This is a major issue for many countries here in East Africa because they are highly dependent on food imports. Many of these commodities could be grown locally, but it's not possible at the moment due to the lack of investment in the past. Even regional supply chains are disrupted by all sorts of non-trade barriers at the borders, including testing of drivers. Have you seen what it's like at the borders at Tanzania and Uganda, Grace?
Yes, I have. It's a terrible situation. Traffic jams that stretch back further than the eye can see.
These traffic jams cause very long delays that affect the necessary export and import of food commodities within the region. So, those countries need to become far more resilient in their own food systems and value chains, especially for major food items like maize and sorghum and beans and milk. Those can be exported but are, for the most part, nationally consumed, but not always nationally produced. The FtMA uses the negative impact of COVID to refocus attention on this. We say if we invest more in these food value chains, it is possible to be competitive, and it will make your country far more resilient to shocks.
In addition to the global supply chain disruptions, what other negative impacts will the pandemic have on countries?
Let's focus on Kenya, but it's the same story in many other countries. In Kenya, we have seen that liquidity in the market totally disappear. Banks have repositioned the money. They look at the safest option, which, in many cases, is just buying government bonds. So it was already difficult to get credit for smallholder farmers and related agribusinesses before the pandemic, but the situation has worsened significantly since the outbreak of COVID. Based on analysis run by the FtMA, that means an agricultural dealer in a rural area will not have the credit to buy seeds, fertilizer, or crop protection materials for the farms. And even if that agricultural dealer has the commodities, the farmer will not be able to buy the seeds, the fertilizers, mechanization services, and crop protection when needed. Just think about the locust problem that we're facing. Nobody has the material because nobody has credit. The agricultural dealer buys from the input providers, and the farmer buys from the agricultural dealer. The farmer buys mechanization services. Very few of those services are paid in cash. A credit element is involved in most transactions. With all the credit disappearing, we predict that this will lead to a 40% decline in production for an average smallholder farmer.
40%? That's a huge loss.
Yes. And if we do some calculations, we can estimate how much bigger the gap will be for essential food commodities in a country like Kenya, which heavily depends on foreign food imports in times when there's no pandemic. We can assume there are 4 to 6 million people in need of support, cash, food assistance, etc.
So if the Kenyan government goes to humanitarian agencies to ask for assistance, what would happen then?
That food, such as maize or potatoes, will have to be bought from abroad for, let's say, $100, $200, or $300 million, then be shipped to the areas where it has to be distributed. That money has to come from somewhere. The last harvest that came up in February and March for maize in Uganda, Tanzania, and Kenya was relatively good. The next cycle starts in August-September, and we know that liquidity in the market has disappeared. We know that there are more and more supply chain disruptions internationally and regionally. This is the moment to convince governments, donors, and humanitarian agencies that it will be much cheaper to invest in food value chains locally instead of buying abroad at a later stage.
What arguments could you make to those governments, donors, and humanitarian agencies to convince them to change their investment strategy?
If the investments are made available now, FtMA and our partners will be able to attract more commercial credit to go back into those value chains. Eventually, the final bill will be far lower for all of the actors involved. And we also say to donors, look, if you do not act now, the food value chains that we work in might take such a hit that we end up back where we were 10 years ago. So all of the capacity building of those food value chains, the credible commercialization, and so on, might be thrown away. And we might have to start where we were many, many years ago. We also say to WFP, you have to increase your advocacy effort and raise funds to help the governments of Kenya to feed its population, and Uganda, and Ethiopia, and Tanzania, and other countries.
Very interesting insights, Adrian. Besides food and agriculture supply chains, what opportunities do you see for other sectors to push the localization agenda further?
If you look at the medical sector, we have the first wave of COVID happening right now, and everyone says there will be a second wave. So, on the health supply chain side, the government, assisted by the Red Cross and many other agencies, might have a couple of months to prepare for a possible second wave. We already know there is not only a lack of testing systems, but we are all afraid of the looming possibility of a lack of drugs. And if they come up with certain drugs that might limit the impact of the disease, or even the vaccines, then it all becomes about logistics. I think we should help the governments to prepare for that by asking ourselves, what can we do to make sure that as many critical items as possible can be either stockpiled here or locally produced? So, I think that whether it's in the context of health, education, food, or a different sector altogether, we should use the learnings from the current COVID era, which is unlikely to be over by September, to bring change to the different aid and development systems and build resilience.
What are some concrete steps that could be taken to introduce that kind of change?
Ultimately, it needs a real rethinking of the way we are working. Forget about a just-in-time supply chain of medicine to optimize cost. That is not going to happen. Even if you have the money to buy it from countries far away, forget about the shipment arriving on time, with all the disruptions that we are currently facing. Certain medicines are not so difficult to produce. They might be under patent, but you can encourage the company to set up production facilities here in East Africa or create generics, so that we are less affected by those disruptions in the global supply chain. We should be less focused on going after the cheapest tender, if that means we have to source from faraway places. We should make sure that production capacity is as close as possible to the area where we anticipate a need for humanitarian relief, or where we have development programs. We should think much more in terms of partnerships with companies that are willing to produce or manufacture locally. We have to start investing in them.
Do you have any examples of where that's already happened?
Yes, the World Food Programme has entered into partnership with the food supplier Africa Improved Foods, or AIF, in Rwanda by giving a guarantee to buy a certain capacity of the supplier's production level over several years. This investment strengthened AIF tremendously, and the investment is now paying off big time. With other factories in the regions closing down and international supply sources being cut off by the system, AIF is able to provide the urgently required food in a very short time. We should follow a similar approach with plastic sheeting, medicines, education, training, and so on. We should partner with companies that are willing to invest. And on the other hand, we should provide them with more long-term commitments and not require them to re-tender every year against competition from other companies.
I remember that you presented the example of the AIF partnership at HELP's very first executive supply chain management training in the humanitarian context at the Kuna Logistics University. Other international organizations who attended the course were rather skeptical about such a partnership between a humanitarian agency and a commercial company. Doesn't this show the narrow mindset of many traditional humanitarian actors, which holds them back in relation to coming up with innovative solutions? How can we change this mindset?
I think that, and I'm guilty of this too, because of our massive humanitarian and development assistance in many countries, we have created enormous dependency. The only way out of this dependency in the mid to long run is to create value chains that are commercially sustainable. It's not good enough to work with local farmers as long as there is funding available. But then, once the money is drying up, we figure out how to quickly hand over. We should start with the exit plan and work backwards. from day one of the project. This handover needs to be the ultimate target and be prepared for. And then, when the right moment comes, it needs to happen.
Any examples of where this strategic approach was implemented and how well it worked?
Yes, we started some years back with trade fairs and training for farmers and small businesses in the rural areas. All of the suppliers came to the trade fairs we organized. All of the partners were there. Whether public or private, the local private sector liked it a lot and asked us whether we would be continuing those fairs. I said, well, if you like it and you see a return in it, then you have to take over. We are willing to help you to organize it, but we're not going to pay for it anymore. So, now those trade fairs and even trainings of farmers and small agribusinesses have been taken on by a number of private sector companies. They recognize that if they invest in trade fairs and in direct training, they will get a return on their investment.
That was a fascinating chat. Thank you so much, Adrian, for providing those insights about localization.
And thank you, Grace, for allowing me the opportunity to share ideas about how supply chains can be improved.